shopping for like an intervention for their newly diagnosed child, right? Because I feel like it could be definitely overwhelming.
Yeah.
It's like there's a lot of resources out there, what's like valid information, what's not. And I know whenever I'm trying to like shop for anything, like even if it's super insignificant, like a food item or like makeup, shopping for anything, the first thing I'm doing is jumping on the internet, going on YouTube, trying to educate myself on the subject and just be a very well-informed consumer.
Yeah.
You know? So, and I remember like when I was a technician, even being like around ABA every single day, because I didn't go to school for becoming a BCBA at that time, I didn't know all the jargon, I didn't know all the terms,
Yeah.
and I remember really wanting to like just look up some cool information on different treatment approaches for ASD or like for teaching a specific skill. And when I hopped online, I was so overwhelmed. So in the spirit of keeping our parents empowered and educated, what tools can we give them for them to make a very well-informed decision?
So I think what we can do today is kind of discuss about maybe 5 or 6 different things that parents should either start thinking about or asking a specific provider or looking at when they're looking at a specific intervention.
All right.
Right? So like one thing that we know for sure that programming needs to be, or the intervention that they use needs to be individualized.
Mm-hmm.
No child with autism is the same.
The spectrum's really
It's super wide, and their child, even though yes, they're diagnosed with ASD, doesn't mean that they're going to be needing the same type of programming or intervention that someone else with ASD might need as well. So we know it needs to be super individualized. It's not cookie cutter. It's not a one-size-fits all approach.
Mm-hmm.
So if they're looking at a therapy online and it kind of says like, here's our curriculum, here's what we give the child, that's probably a red flag that that's not going to be the best therapy for them.
Okay, so when you say curriculum already, just make sure I'm understanding. Like basically if there's like a pre-written curriculum, that's trying to do the one-size-fits-all, right? Trying to make the child conform to the curriculum.
Right.
And that's not individualized. Okay.
Yeah, it's not tailored for that specific
Okay.
kid. So that would definitely, cause parents to, put up a red flag. Okay, this probably isn't the best approach for my kid.
So Carly, you told me a little bit about how treatment should definitely be individualized. It shouldn't be a one-size-fits-all. But so let's empathize with the parents though for a second. If they have a child who's newly diagnosed on the spectrum, the first thing they're going to do, like chances are, is get on the internet and Google like autism cure.
And we know that there's no cure for autism.
Okay, so there's no cure. But what about all those testimonials? Like they're so convincing, they're so believable, they just pull at your heartstrings, and you like, what do you have to say about that?
So with testimonials, we know they do not equal effective intervention for children diagnosed with autism. They're someone's opinion, and they can become super convincing, and that's why typically they're mainstreamed too through a lot of media outlets.
That makes sense. Okay, so I know treatment should be individualized and not to trust testimonials. So can you give me some advice on where to go? What do I look for?
So parents really want to make sure that the conversation is revolving around science. Science should be at the forefront of every conversation they have about effective autism treatment. And so if science and research isn't in any of the intervention or treatment that a specific provider is offering, that would also probably be a red flag where parents would be pretty wary of that as well.
So when you say science, like what are we talking about? Because I feel like a lot of things can be advertised as like, oh, this is scientific. I could go like try to like propose, I'm going to do a research study on this, so it's science.
We want to look at evidence-based science, right? And there's a 3-prong approach to understanding if it is evidence-based science. So the first prong is looking at the actual intervention that they're giving. Is it backed by research?
So what do you mean about research? Like when you say research, like it needs to just have one research study done on it?
No, so we should be making sure that the intervention that's being used has been replicated time and time again to show its effectiveness and to show that it works across multiple different kids in lots of different cases.
Okay, so just as a recap, science-based or evidence-based practices, we have to look at the research. What else do we have to look at?
So we also have to look at clinical expertise. Whoever is providing that intervention needs to make sure that they have certifications within that specific intervention, training, and some background experience as well.
Okay, that makes sense. So background experience, we have to look at the research.
Yep, and really good training and certifications. That's super important to make sure that whoever's providing the service is actually qualified to do so.
Okay, that makes sense. What else can we look at?
And then lastly is really looking at the client value. So whatever goals or treatment that they're wanting to give you, is it actually socially significant? Are they going to be making a really big difference within your home, your community, and your school?
Okay, so you're saying that it should be socially valid, socially significant, so I should be seeing a change in my day-to-day routines?
Right, so your day-to-day routine should be changed because you as the parent and the interventionist is coming up with the goals together, and they're making sure that your concerns are heard.
So, I have a say, you have the clinical expertise, you have the education in the background, but, I still have a say?
Yeah, parents' concerns and opinions definitely matter within the goals for treatment planning.
Okay, so I'm looking for an individualized evidence-based treatment. So what else should I be, looking for?
So parents should also be making sure that they're very persistent and asking a lot of questions when finding the right provider, right? We know they're investing this huge amount of time and making a huge investment. So you're not just going to go with the first place that you find.
That sounds right about, okay. So,
Right.
And I should be advocating for myself and my child.
Right, so you should be asking the provider a lot of questions just like you would at a job interview, right? You want to make sure that you're really finding the place that's going to best fit your child's needs.
Okay. Do you think it's kind of intrusive if I'm asking all those questions? Because what you're saying sounds really good, but do you think the provider might get a little,
Annoyed by
Yeah.
all of asking the questions? No, so you're making a huge investment for your child. It's going to be a lot of time and a lot of energy, and time is of the essence.
What do you mean by time is of the essence?
So we know the earlier that the child gets into intervention, gets that early intensive intervention, then they're going to be making better progress. So the sooner they get in there, the better. And you want to close that gap.
And I hear about this gap. So, and the way it was explained to me is my child is over here, a typically developing peer might be over here, so there's this gap. So what you're saying is if I get into treatment later, or if I don't find the right treatment in time, that gap's going to
get wider.
Okay,
Right?
and it's going to take longer to catch up.
Right, you want to close that gap. So the sooner that the child gets into therapy, the better.
Okay, so I'm looking for a treatment that's individualized and tailored to meet my child where they're at. My child shouldn't have to conform to a curriculum or conform to an intervention. And I should be looking for something that's evidence-based. I gotta cut those testimonials out. They're heart-wrenching, but I gotta do it because the treatment needs to be evidence-based. There has to be research.
Yep.
Right.
And then the parent should also be really persistent in asking lots and lots of questions to their provider. It's like an interview for a job process, or for a job, because it's a huge investment, and a huge investment of time and energy that they're putting in for their child's success.
And then my family's values are at the center of the treatment too.
Yep. 100% matters.
All right, I definitely feel more informed now.
Awesome. I'm so happy.